Good morning, Mariposa. Eric Sergienko, your County Health Officer, with this COVID-19 update. Wow, it's been a week since we did our Facebook Live, and a lot has happened in that time. A lot of guidance from the state, the most significant of which is the State Health Officer's order from last night, which was basically a statewide shelter-in-place order. Similar to a local health officer's order, but applied statewide. We as local health officers up and down the state are kind of digesting what that actually means for us as counties, and we'll have more on that probably by the end of the day, but I felt it was important to reach out to you today and kind of give you an update of what that order means in regards to Mariposa. So let me start with the baseline. What we know is that as of this morning, there are still no confirmed cases of COVID-19 in Mariposa. We continue to do testing and we continue to receive negative test results. In our adjacent counties, the news yesterday is we had 2 additional cases in Madera County. That may represent community transmission, but the team there is investigating that and is attempting to do contact tracing and remain in the containment phase. Here in Mariposa, again, because we have had no cases, we remain in the containment phase. And really what I want to set the context with the state health officer's order is they are already planning for the surge phase. That is, they have numerous counties that are currently showing community transmission. And because of that, they are concerned that despite mitigation strategies applied in those communities, including the shelter-in-place orders, that they will have COVID-19 patients in excess of their existing hospital beds. So they're thinking about, how do I slow down the spread? How do I reduce the number of sick people so that I don't stress my healthcare system? While at the same time, the governor and his team are looking into how do they build bed capacity. We're doing some of that same planning here in Mariposa because the prudent thing for us to do is to be ready to go ahead and move into that surge phase should that be necessary. So again, we're still in containment phase. We're preparing for mitigation phase when that should happen. I already have a health officer's order in place that is a contingency order for when we start having cases in the county. But I think one thing that's on everybody's mind this morning about the state health officer's order is what exactly are those essential critical infrastructure functions that allow those people to continue going to work. So I'm going to look over here at my laptop and tell you what those are. So healthcare operations and essential infrastructure, and those include things like grocery stores, certified farmers market, farm and produce stands, essentially everything associated with ag. So if you're out there tending cattle, doing things with livestock or with other ag products, that is clearly good to go. Businesses that provide food, shelter, and social services and other necessities of life for economically disadvantaged or otherwise needy individuals. Communication services like newspapers, television, radio, and other media services. Gas stations and auto supply, auto repair, and related facilities. Banks and related financial institutes. Hardware stores. Plumbers, electricians, exterminators, and other service providers who provide services that are necessary to maintaining safety, sanitation, essential operations. Businesses that provide mailing and shipping services. Educational institutions including public and private K-12 schools, colleges, and universities. Laundromats, dry cleaners, and laundry service providers. Restaurants and other facilities that prepare and serve food. But the key feature here is for takeout only. No dining in options, even with social distancing measures applied. Businesses that supply products needed for people to work from home. Businesses that supply other essential businesses with the support or supplies necessary to operate. Airlines, taxis, and other private transportation providers. Doesn't so much apply here in Mariposa. Home-based care for seniors, adults, or children's. Residential facilities and shelters for seniors, adults, and children. And child care facilities providing services that enable employees exempted in this order to work as permitted. So I think that's important for us. I know that childcare here in Mariposa is in short supply, but if you are a childcare provider and you have children that are the children of essential employees, so people who work in healthcare, people who work in public health, who work in other essential services, we really encourage you to stay open. All right, that's the list. There's a lot on it, and again, what we're doing right now is local health officers in conjunction with our other government officials are kind of defining that, and at this point, we're not going to be strictly enforcing it. I think from a shelter-in-place standpoint, we're appealing to your goodwill to be conscious of where you are, what you're doing, and maintain that social distancing. And do the other personal actions that reduce the likelihood of you spreading COVID-19. And you know what those are. Wash your hands, cover your cough, stay home if you're sick, stay away from people who appear ill, and don't touch your eyes, your nose, or your mouth. Thanks so much. As we get more information, we'll push it out to you. Thanks for staying with us. Mariposa strong.